Hi, this is Dr. Ned McArthur with Integrated Pain Specialist. This video is number 7 in a series of videos about spine pain. After the last video, I started thinking there was more I could share about movement and how movement can be used to decrease your spine pain. In this discussion, I want to introduce the concepts of proprioception and coupled motion. Proprioceptors are nerve endings that are found in many of our tissues. Proprioceptors tell the brain where things are in space. Now, as an example, take your left index finger and thumb and grab your earlobe. Okay? You can't see your ear, so how are you able to do that? You were able to do that because you have proprioceptors or position sensors. These are nerves telling your brain where everything is. And then the action part of your brain connects the dots and bring your fingers and ear together. Now let's go to our second concept, coupled motion. Now, couple means two, right? When it comes to movement in our spine particularly, it means when I side bend, two movements actually take place. Bending to the side and rotation, meaning think of it, movement is three-dimensional. So if I have this spine here, okay, when it bends this direction, okay, they bend this direction, but at the same time, they're also rotating the opposite direction. Just think movement is three-dimensional. And this is important because the proprioceptors are laid out in a three-dimensional pattern. And if my spine isn't coupling correctly, I won't be activating a large portion of the proprioceptors in the joints and muscles, thus decreasing the amount of proprioception or input into my brain. Now, this is highly significant to those who experience chronic pain. And I define chronic pain as pain longer than 3 weeks. Here is a good example. Okay, so we've got a nerve. Pretend like this tube here is a nerve. Pain and proprioception travel in the same nerve pathway. And if you're old enough to remember when a phone would used to get a busy signal, the same kind of thing happens. You have enough proprioception going in, there's not space or bandwidth for pain, and thus you feel better. Now, as an example, if you were to smash your finger, what is your natural reaction? We grab it. Or when I was a child, I'd stick it in my mouth. What does that do? Right, it helps it feel better. And the reason it helps it feel better is because when we grab it, we're activating proprioceptors in the skin, muscles, and joints of the finger. Of all the input into your brain, 90% comes from the proprioceptors in the joints and muscles of your spine. So, if you've got a bad spine, what do you think happens to your proprioception? Right, it goes down. Without good proprioception, what happens to your ability to suppress pain? It goes down. This is why I almost always include spinal adjustments in a treatment plan, because it increases proprioception and increases your body's ability to suppress pain. Now, there are lots of ways to test for proprioception. One test I like is called finger-to-finger test. You put one index finger above your head and then with your eyes closed, touch the tip of that finger, that index finger, to the tip of the other, okay? So go ahead and do this yourself. So again, one finger up, bring the second here, and you get them together. Now, how did you do? If it wasn't perfect, you have less than ideal proprioception. If your proprioception is diminished, it doesn't mean you're going to have pain. Bad proprioception lowers your threshold for pain, so it's more likely you'll have pain. If you have questions about your spine pain, give us a call at 801-816-0332, or you can find us online at integratedpainspecialist.com. See you on the next video. Thanks for watching. Goodbye.